last topic we have is impetigo, and it is a bacterial infection. Next slide. Impetigo is a common and highly contagious bacterial skin infection that mainly affects infants and children. So these are the ones that you need to look out for this disease. Impetigo usually appears as red sores on the face, especially around children's nose and mouth, and on hands and feet. The sores burst, develop honey colored crusts. Treatment with antibiotics is generally recommended to help prevent the spread of impetigo to others. Well, antibiotics because it is a bacterial infection. That's the way to go. It's important to keep your child home from school or daycare until he or she is no longer contagious, usually 24 hours after you begin antibiotic treatment. So it's highly contagious. So if the child has the disease, it's good to isolate him and not go to school, so he doesn't affect other children. Symptoms. Classic signs and symptoms of impetigo includes red sores that quickly rupture, ooze for a few days, and then form a yellowish brown crust, kind of like pimples, but they pop on their own mainly. The sores usually occur around the nose and mouth, but can spread to other areas of the body by fingers, clothing, and towels, usually through open spots on the skin. So any cuts, any openings can lead to infections on other parts of the body. Less common form of the disorder, called bullous impetigo, may feature larger blisters that occur on the trunk of infants and young children. Like we all know what the trunk means. There's a more serious form of impetigo called edema, and penetrates deeper into the skin, causing painful fluid or pus-filled sores that turn into deep ulcers. So it can get pretty serious. Next slide. When should a person with impetigo see the doctor? Well, basically, if you have impetigo, go see the doctor because it can get pretty serious. Any child that has impetigo should see a dermatologist or the family doctor straight away. Next slide. Risk factors that should be looked out for in prevention of impetigo is age. It mainly occurs to children 2 to 5 years old. Crowded conditions. Well, usually with contagious diseases, being in a crowded position does not help, especially in schools, as children could be sometimes like lacking in, like they touch everything they see. So schools are a main place of these infections. Warm, humid weathers. It is more common in the summer and like more humid areas in general. Certain participation in sports that involve skin-to-skin contact, such as football, wrestling, basketball, anything that involves skin-to-skin contact is puts you at risk. Broken skin. The bacteria that causes impetigo often enters the skin through a small skin injury, insect bite, or rash. So if you have any opening, any bruises, a jarh, cover it up, make sure that it's sanitized, and so you don't get infected with any contagious disease. Adults and people with diabetes or weakened immune system are more likely to develop edema as well. Complications. Impetigo typically isn't dangerous, and the sores in mild forms of the infection generally heal without scarring. Rarely, complications of impetigo includes cellulitis. This potentially serious infection affects the tissues underlying your skin and eventually may spread to your lymph nodes and bloodstream. And if it goes into the bloodstream, it can be really serious. Untreated cellulitis can quickly become life-threatening. It can also lead to kidney problems. One of the types of bacteria that causes impetigo can also damage your kidneys, especially if it gets into the blood. And you can go through serious scarring with impetigo, especially when it comes to your face. And nobody wants to have a scar on their face. Yep, I think that's it.
Keeping skin clean is the best way to keep it healthy. It's important to wash cuts, scrapes, insect bites, and other ones right away. To help prevent impetigo from spreading to others, gently wash the infected areas with mild soap and running water and then cover lightly with gauze. Wash an infected person's clothes, linens, and towels every day and don't share them with anyone else in your family. Wear gloves when applying antibiotic ointment and wash your hands thoroughly afterward. Cut an infected child's nails short to prevent damage from scratching. Wash hands frequently. Keep your child home until the doctor says he or she isn't contagious. Doctors usually diagnose impetigo by looking at the distinctive sores. Lab tests generally aren't necessary. If the sores don't clear, even with antibiotic treatment, your doctor may take a sample of the liquid produced by a sore and test it to see what types of antibiotics might work based on it. Some types of the bacteria that cause impetigo have become resistant to certain antibiotic drugs. Impetigo typically is treated with an antibiotic ointment or cream that you apply directly to the sores. You may need to first soak the affected area in warm water or use wet compresses to help remove the scabs so the antibiotic can penetrate the skin. If you have more than just a few impetigo sores, your doctor might recommend antibiotic drugs that can be taken by mouth or oral medication. Be sure to finish the entire course of medication even if the sores are healed. This helps prevent the infection from recurring and makes antibiotic resistance less likely. For minor infections that haven't spread to other areas, you could try treating the sores with an over-the-counter antibiotic cream or ointment that contains bactericin. Placing a non-stick bandage over the area can help prevent the sore from spreading. The causes: you're exposed to the bacteria that cause impetigo when you come into contact with the sores of someone who's infected or with items they've touched, such as clothing, bed linen, towels, and even toys. Here's the end of the presentation. Thanks for your attention.